Hello, everyone. Thank you for listening to our presentation titled Exploring Faith Community Nurses' Potential in Japan. Authors are Ms. Keiko Noguchi and myself, Yui Matsuda. Before talking about the study, I will describe some current trends, situations, and challenges Japan is facing. This is important because we will be talking about how faith community nurses can serve to meet the needs of the communities in Japan. First, our Christian population is 0.8%. People seek different ways trying to rest their souls or follow customs of Buddhism or Shintoism for certain life occasions. Second, Japan is the fastest aging society in the world. This is known as the most significant issue in our country. In addition, our fertility rate is low. Given the situation, the working generation needs to support medical expenses and pensions of older generations. Thus, country as a whole is very concerned about the future. In addition, as the population ages, 1 in 2 people are being diagnosed with cancer. The number of people with spiritual pain due to cancer is increasing in the community. Third, social withdrawal, or hikikomori, along with high suicide rates, among other mental health concerns, are alarming in Japan. Knowing some of the challenges Japan is facing, nursing practice in community settings is critical, especially where the typical private and public health services are not reaching. For example, in a rural area of Japan where people rely on cars as a mode of transportation, a nurse noticed that some older people do not go to hospitals or clinics. She also noticed that these older people go to a gas station to get together with their friends. So the nurse thought to be at the gas station to provide health counseling there. This initiative has been very successful, and more of this kind of approach may be helpful. As we think about reaching communities, faith community nursing is also a practice that do not belong to hospitals, visiting nurses associations, or the government. Thus, the authors think that with the unique characteristics of faith community nursing, we can serve communities of need. We also have to be mindful that people may be unfamiliar with the Christianity and may be skeptical of religions, as some cult groups kept causing problems, but people may not be able to distinguish one from the other. So we need to be able to explain clearly about the practice of faith community nurses, especially to non-Christians. The purpose of this study is to explore the significance of faith community nursing in Japan. Specifically, there are 3 research questions that we're raising as a part of this study. What is the significance of serving a faith community rather than a general community? That is number 1. Number 2, what is the significance of serving part of a faith community rather than serving as an individual nurse? Number 3, what is the significance of being a nurse rather than a pastor or priest? Methods. This was the way the study was done. First, the literature search was conducted. Then, using the synthesis of the literature, the authors explored how faith community nursing could address the unique needs of individuals and communities in Japan. Literature search was done using a reputable nursing database called CINAHL. The search terms included faith community nursing or nurse and parish nursing or nurse. Search years were 2010 or later. The authors initially found a total of 159 articles, but omitting duplicates and irrelevant ones, 16 articles remained for review and synthesis. All of them were from the US. The first research question is, What is the significance of serving a faith community rather than a general community? Our concise answer would be faith community nurses bring peace of mind, holiness, and affirmation of existence to clients through the assurance of being there. We will explain further about this answer in the next few slides. By the way, we refer clients as the people whom faith community nurses are serving. We found evidence illustrating the inevitable reasons that faith community nurses are made to actively serve through a church. A qualitative study inquired why people chose faith community nurses, and the client responded, I think when my son passed away, she, a faith community nurse, was there as far as compassionate. You know what I mean. She didn't talk, she listened. In a qualitative study that explored clients' experiences when faith community nurses provide spiritual care in Christian churches, one client responded, sometimes there would be tears and sometimes there would be joy, but always there was an absolute unconditional acceptance, absolute love. Sigh. Another stated, it's okay to be angry and offered to pray. Mostly it was her acceptance of what was empty in my life and my fighting it. From these examples, the clients of faith community nurses gained a sense of acceptance through being listened to. As faith community nurses have faith and awareness cultural expertise, faith community nurses can listen to the other person's feelings without making them feel judged, bad, or rushed. Expanding on the awareness of cultural expertise, one study focused on the role of faith community nurses in domestic violence. It is possible to listen to a client neutrally while considering or assessing whether there is a need for specialists such as the police or the hospitals. Another stated, you were not so much a nurse, you were like a friend. Faith community nurses make our professional side of things invisible as needed so that the clients feel closer to them and to be able to share things that they may not at clinics or hospitals. At the same time, faith community nurses are assessing clients' needs and advise clients to ensure safety, which is important for the victims of domestic violence. Or when faith community nurses see that clients are ready to listen to faith community nurses or seeking faith community nurses advice. Being there is an aspect that came out as important. A client from Vandover's study in 2011 stated, when you are sick, you need someone to do more than just take your blood pressure. You need someone who is there for you. And that is an important thing, that feeling safe. Another study by Sistema et al. In 2021 stated that the faith community nurse was always there to help us. Being there can be interpreted as being on your side or being available and or being available at the church. This is a stable location in a community. Thus, we can say that the clients are relieved by the assurance that there is always a familiar nurse in the church. Faith community nurses can care for their clients regardless of the medical settings they're in or are involved with. For example, a client may be at home, then admitted to a hospital, then return to home again. Faith community nurses can follow the client across the medical system or even locations. 4 publications mentioned this point. Moreover, faith community nurses do not have time constraints as other healthcare providers who may have many tasks at work. All that considered, faith community nurses can give clients assurance of being there for them. Some of the articles spoke about Christian narrative perspective and quoted, "Bring in the Lord God," or "She is always there," and of course, Father is also there. What can we learn, particularly thinking about the Japanese society? As faith community nurses are wearing the church and the church being a house of prayer, such holiness of the church as an important foundation of faith community nursing could bring people to His holiness. Regardless of this being conscious faith or not, people or clients may be drawn to satisfy their spiritual hunger. Here, the summary in response to research question 1, which is, what is the significance of serving a faith community rather than a general community? First, faith community nurses are culturally aware, so they are able to listen to clients' concerns and allowing them to feel accepted. This is important as Japanese people tend to have low self-esteem, thus their needs to be accepted are likely to be even higher than other countries. Second, FCNs are always in a place of church or where in the church. Faith community nurses are there to listen to the clients, providing certainty. Faith community nurses are serving through churches so they can support clients regardless of their phase of care and or their healthcare providers. The role of faith community nurses aid in people to seek support from church and to respond to the client's spiritual needs. Now, Ms. Noguchi will continue with the results of research question number 2.
The second research question is, what is the significance of being a community rather than a single nurse? Our answer would be, because people gather by faith, the communities were diverse. The communities became a place to care for each other through rich fellowship. It can be explained from 2 aspects. First, regarding experienced people. Second, regarding volunteers. Regarding experienced people, Davido wrote about preventing diabetes among pregnant African American women, addressing the health disparities. In the church community, she says, they can discuss with wise women groups. We think it means that the church has the advantage of being able to connect with experienced people. In Japan, there are many communities in the area where there are only the young generation, only the elderly, and no middle-aged men who are too busy to mingle with the community. Moreover, the number of nuclear family households is increasing. A wide range of generations gathers in church communities because communities are centered of faith. Therefore, authors think that it is valuable to have a place where you can come into contact with people like the experienced wise women. Regarding volunteer, the authors found that faith community nursing practice has focused on pregnant African American women, local elderly people who are experiencing loneliness, homeless individuals. Collaboration with other volunteers with or without healthcare background is necessary to successfully execute faith community nursing practice. Here are the summary in response to research question 2. Research question was, what is the significance of being a community rather than a single nurse? First, church communities are gatherings of people with a diverse background. They are united in the faith of Jesus Christ. Second, because the church community has biblical values, There are more people with a spiritual or frontierism in the church communities than in major Japanese communities. Thirdly, these rich fellowships can make it possible to tackle local issues that are out of the reach of the government. The third research question is, what is the significance of being a nurse rather than a pastor or priest? Our concise answer would be, faith community nurses met the spiritual needs of the community that the pastors or priests alone could not reach. We have to think, if you want to provide spiritual care, you can be a pastor or priest. But why do you need to be a nurse? Westberg, who created faith community nursing originally, said faith community nurses have the characteristic of being a bridge between science and religion, and that characteristics is the origin of faith community nurses. This figure is the bridge between science and religion. The left end of the bridge is science, the right end is religion, and faith community nurses are on the bridge connecting them. Additionally, faith community nurses can go either way or stay neither. Authors think that Westberg's bridge means that faith community nurses can move freely on the bridge. We think for holistic human care, nurses who can stand on both perspectives and see both perspectives from the center play a very important role. Because of its flexibility, faith community nurses can connect their clients to clerics and scientific experts. This freedom is the significance of being a nurse, not a pastor or priest. According to the prior literature, 12 of the 16 studies involved in caring for persons with a medical diagnosis. What can be said from the studies in the previous slide? We can see that people seek the care of faith community nursing for their scientific expertise. In a study interviewing 17 service recipients about why they choose faith community nurses as their healthcare provider. This study presents the holistic activities of faith community nurses, from blood pressure monitoring to spiritual care. From here, we can see that faith community nurses provide care from science-based medical care to religious care based on holistic human relationships, such as prayer and being. At first, faith community nurses took blood pressure and screened for osteoporosis. Next, they provided medical and welfare information. Thirdly, they offered health advocacy. Lastly, they provided spiritual care through listening. Faith community nurses entered from the scientific point of view, which was through medical diagnosis. And from there, they were guided to spiritual care. This is the characteristic of faith community nurses. Faith community nurses are their clients are led to the holy place through spiritual care, and they may meet Jesus there. We can say, as faith community nurses care for those who are physically, psychologically, and socially vulnerable, faith community nurses and their clients meet Christ. Here are the summary and response to research question 3. Research question was, what is the significance of being a nurse rather than a pastor or priest? First, faith community nurses are involved in spiritual needs that emerge precisely because they stand between science and religion. Second, faith community nursing practice allows faith community nursing to connect clients to more specific care provided by pastor or priest and other healthcare professionals on both ends on the bridge. Lastly, the encounters faith community nurses have with their clients because of their vulnerability are the blessings the Lord brings to the nurses. Here is the conclusion. This study illustrated that faith community nurses are meaningful in Japan because they can serve the communities while taking advantage of several characteristics that faith communities can have. This study addresses Christian values in nursing through the role of faith community nurses in community settings. Our study will serve as the foundation of the current faith community nursing practice in Japan. The work of faith community nurses have been actually started in Japan, and if you want to learn more about it, please go to Keiko's presentation. Thank you for listening.